Hey everyone, it's Dr. Penny with the Veterinary Insider. I wanted to touch base with you on a topic known as steroid phobia. It seems that a lot of pet owners out there are afraid to have their veterinarians give their pets steroids to control skin allergies or arthritis for fear that it's going to harm their pet, and nothing could be further from the truth. When we talk about steroids, there's two main classes that most pet owners are aware of. The first is anabolic steroids. That's not what we're talking about. Those are the steroids that weightlifters take and that the baseball players took and got into all that trouble. No, the ones we're talking about are catabolic steroids. Now, the body does produce cortisol, which is a natural catabolic steroid. And the ones we're talking about as veterinarians giving are the synthetics, which are prednisolone and methylprednisolone, triamcinolone, Betalogue. That's a very popular injectable form to control skin allergies. Dexamethasone. These are all synthetic catabolic steroids. This is the class I am talking about. Steroids have many, many uses and are very important, not only to veterinary medicine, but to human medicine as well. They're used to treat allergies in dogs and cats. And by far, they're the best way to control itching caused by these allergies. They're used to treat autoimmune diseases. In fact, some of these diseases can be fatal if steroids aren't given. They're used to treat arthritis in pets, especially in cats who are sensitive to the non-steroid anti-inflammatories. And they're also very useful to treat arthritis in very old dogs who don't respond anymore to the NSAID therapy that they're being given. Steroids are effective at counteracting allergic reactions, much more so than, say, Benadryl is. And finally, circulatory shock, when that occurs, steroids can be life-saving. So there's many, many uses, and they're in very important classes of medicine. Now, when talking about skin allergies, steroids versus alternative therapies, there's a number of considerations to take into account. The first is cost. Now, whenever possible, it'd be nice to use an alternative therapy and stay away from steroids if possible. However, some of these alternative therapies are very, very costly and far exceed the budget of many pet owners. Some of these include that Atopica, which is used by dermatologists to control itching in lieu of steroids. The hyposensitization injections, which are similar to what people take when they have allergies. Those can also be very expensive, so cost may be prohibitive. Steroids are very cheap. Effectiveness, nothing beats the steroids for controlling the itching that is caused by skin allergies. Safety, if steroids are used properly and in the right amounts and for the right duration, they're very safe. For arthritis, steroids and non-steroid anti-inflammatories are often used. Now, most veterinarians, including myself, will attempt to start off with NSAIDs in dogs, the non-steroid anti-inflammatories. Some of these you may be aware of are Rimadyl and Deramax, Previcox. Those are all the newer classes of NSAIDs. Now, those are pretty costly compared to steroids, so that can be an issue. NSAIDs are effective. However, steroids tend to be even more effective anti-inflammatory medications. In safety, again, for long-term use, steroids aren't the best choice for arthritis treatment. However, in older pets that are suffering from end-stage arthritic pain, steroids can be wonderful medications to improve their quality of life. And because they're older, you really don't worry about the long-term side effects years on down the way, because the pet's older and it's probably going to succumb to some other illness or disease before it runs into side effects from steroid therapy. So again, think quality of life. The bottom line is this: there's no reason to fear steroid therapy if that therapy is used properly. Now, there's a lot of veterinarians getting out of vet school now who won't use steroids, mainly because they were taught that in vet school, that steroids are bad and you shouldn't use them and use other means. However, that fear is unfounded. I've been in practice well over 25 years and have used steroids in patients very safely over that period of time. It's just knowing how to use them. Make sure your veterinarian knows how to use them. But when used properly, they're safe and they're super, super effective. Now, they should never be used in pregnant or nursing pets or pets undergoing surgery, steroids can delay wound healing and cause problems with that. So if your pet is on steroids, and your veterinarian, from another veterinarian, you take them to a different veterinarian, make sure that new veterinarian knows that your pet is on steroids before doing any surgery. Steroids shouldn't be used for pets with severe infections or suffering from organ diseases such as kidney or liver disease. And like the non-steroid anti-inflammatory, steroids can sometimes upset the stomach, so it doesn't hurt to give a Pepcid along with that steroid. Now, long-term continuous use of steroids, yes, you can run into some pretty severe side effects and problems if they're used that way. Some pets, they have to be, just because of the nature of their illness. But it's best to use them short-term and with interruption. Now, when I say interruption, if a pet has been on steroids for weeks or even months, before taking them off, they have to be weaned off those steroids slowly to prevent problems. See, when they're taking the steroids, their body stops producing cortisol. So if you just abruptly stop your steroid therapy, your body won't be able to kick back into the cortisol production, and it could be life-threatening. I mean, steroids are important for life, so make sure those are weaned off slowly. So the bottom line is this: it's about quality of life. Now, if your pet's condition can be managed without steroids, then do it. However, if it can't, then don't be afraid to have your veterinarian use those. It's really, again, about quality of life. You don't want your pet to go through life just itching and miserable. When a steroid shot or oral steroids used judiciously can help quell the clinical signs. The same with older pets with arthritis. My gosh, if the NSAIDs aren't working, give steroids to improve their quality of life. It's not, in some cases, it's not about quantity, right? It's about quality.